Okay, have you ever noticed how you walk around a parking lot or a grocery store and see the lowered shelves or more handicapped spaces? I'm sure we've all seen people or even have friends with special needs or ADHD. Having a sister with special needs has really taught me a lot and opened my eyes about the whole special needs world. Although special ed kids are known about, not many people know the facts or diagnoses or treatments that there are available. So today I'll be talking about Down syndrome, cerebral palsy, ADHD, and autism, which are all very common in the United States today. The first thing I'll be talking about is Down syndrome. It's one of the most common mental disabilities today in the United States. The National Advocate for People with Down syndrome reported 1 in every 691 babies are born with Down syndrome. It's really evolved through history. So in 1983, the life expectancy age for kids with Down syndrome was only 25, and today in 2014, it's early 60s or early 70s. And there are different cases, so some of them are more severe and some of them are more mild. Gina Kolta, the author of Understanding Down Syndrome in the New York Times, talked about the 21st chromosome. So Down syndrome affects the 21st chromosome of somebody. You either have a partial chromosome or a full extra chromosome. And it's Down syndrome and the 21st chromosome are also linked to cancer, leukemia, brain changes, and Alzheimer's disease. So as you guys can see, I have a sister with Down syndrome. Her name's Kathleen. She's 9 years old. She has speech problems, so like orally it's hard for her to talk, so she does go to the University of Northern Illinois and learn how to talk better. And she's also involved in physical therapy to help her muscles because children with Down syndrome tend to have a low muscle tone. And caring for her is kind of hard because she gets frustrated because sometimes she's hard to communicate with, but we do cooperate and she's like one of my best friends. So. Alright, the next thing I'll be talking about is cerebral palsy, which is another common disorder. It affects the brain and muscles of somebody. Cerebral meaning brain, and palsy means lack of muscle control. So people with cerebral palsy have often a hard time walking, and it can affect the brain, so sometimes they have special needs as well. There also are extreme cases and mild cases, and there's no profound disability, so it doesn't worsen over time. If you're born with cerebral palsy, it's not going to get worse. It is muscle impaired movement structure and irregular posture for somebody, so they do need things to help them walk, so wheelchair or often those hand things that you see some people walking with. There are different types and cases as well, and it depends on the injury to the brain. According to MayoClinic.org, the symptoms are variations in muscle control, stillness, lack of muscle control, brain delays, and unfortunately there is no treatment, but there is lots of therapy and utensils to help these people with cerebral palsy. According to kidshealth.org, his name is Keith. He's a college student just like we are, and he has cerebral palsy, so walking around a college campus can be often difficult. And as I quote, "I'm in college now. As a teen with cerebral palsy, it was easy for me to get overlooked, discouraged, or even patronized simply because I wasn't considered normal. This became especially apparent when doctors began prescribing special durations to help me reestablish or maintain a suitable range of motion. These devices were to be worn while doing everyday activities, including school activities." So it's kind of hard to imagine how we can just walk around. He would often get stared at or just looked at differently when really he was just like us. And as I quote again from Keith, "Fortunately, I have a very mild case of cerebral palsy and only my walk is affected. My hamstrings and heel cords are spastic, meaning they might twitch or spasm on their own and I can't control them, or tight. This causes me to walk bent-kneed and on my toes." Okay, so now that we've talked about cerebral palsy, I'm going to be talking about ADHD, which is completely different than any other mental disorder because it's so common. I know that we talked about it in class. I know some of you guys have it, friends have it. I know sometimes I have it. So it's also one of the most common in the U.S. and it's according to the National ADHD National website, there are different causes. So CHAD website states that the causes are unknown, but genetics also play a role because there's an error in neurotransmitters when you're born, so it's just an attention deficit disorder. It's also common in babies with low birth weight and head injuries when they're born. Environmental factors play a role if you have ADHD, and also if the mother smoked or drank while pregnant with the baby. Jeanette Ashley Gunter, the author of Update of ADHD, talked about different medications. So I know there's Adderall and Ritalin and different milligrams that are diagnosed to the patient to help them with their attention deficit disorder. There's also side effects while taking medication, so it's loss of appetite, dizziness, No, yeah, so it's just completely different. So it's just different because there's different treatments and medications for ADHD. Some symptoms for ADHD that people are often diagnosed with, easily distracted, difficult focusing, becoming bored on different tasks and switching to different activities, not understanding or finishing your homework and struggling with instructors' directions. An example, so Sarah was 14, this was on the CHAD website for ADHD, and she noticed that she sat in the back of the classroom a lot, she wasn't paying attention, so her mom noticing her grades, and that's just very unlike her. So she ended up going to the doctor and was diagnosed with ADHD and ended up taking medication. It really did help her. So I don't know, some people have ADHD and they don't even know it. The last thing I'll be talking about is autism, which is also another form of a mental disability. And it's called ASD, Autism Spectrum Disorder. It's just a general term for a group of complex disorders with brain development. So there's different types and different severities of autism. I'm sure we've all seen somebody with autism before because it is very common. It affects a large, major population of the United States. And according to Sarah Glazer, if you have autism, it's normally diagnosed by social impairments, difficulty communicating, abnormal or pattern behavior, and affects every different age group. So as you can see, special needs are becoming more known and widely recognized throughout the United States through technology. Research is becoming more advanced with helping treatments and people with special needs. And I hope that now I talked about special needs that you guys will help recognize somebody if they have complications or need help with something and just raise awareness. So thank you.